Hello, welcome to this channel. If it's your first time, please click on the subscribe button. My name is Dr. Rita Jabin, and today I have a very interesting topic for you. And the topic is 2 home remedies to tackle, to treat, to cure pelvic inflammatory disease. The Center for Disease Control has proven or shown that 4 out of every 10 women are infected with pelvic inflammatory disease, and they are not even aware. And so today you will get the knowledge and what you're supposed to do to be able to get yourself treated and get it fixed. Now, what is pelvic inflammatory disease? In a simple term, pelvic inflammatory disease is an infectious, inflammatory disease of the pelvic system, of the female reproductive system. Usually we'll say the upper female reproductive tract, which includes from the vagina to the cervix, to the uterus, to the fallopian tubes, to the ovaries. All this put together are the pelvic system. So when a bacteria finds its way from the vagina and ascends and takes over this whole pelvic region, you say that the person has pelvic inflammatory disease. What causes pelvic inflammatory disease? Now, from the CDC statistics, it has been shown that 2 bacteria are the main culprits. Now, the first one is Chlamydia trachomatis. Now, Chlamydia trachomatis affects most of the 70% of the people that have this infection. It is this bacteria that causes it. Some other group, it is caused by Neisseria gonococcus. That's the same bacteria that causes gonorrhea. Now, what happens is this. When someone has sex or has a sexual relationship, maybe not all through penetration, but whatever sexual intimacy you have with someone that is infected with this bacteria, you find out that you can pick it up from this person. That's why it's a sexually transmitted infection. And what are the age group? Science has shown from the statistics that from the age of 20 years and above, and it's usually more prevalent among people who are still menstruating. So most people who are already in menopause, women already in menopause, may not have pelvic inflammatory disease, although if they had it when they were young, it could still go into when they get older. And so what do you do if you have pelvic inflammatory disease? I'll get to that. But now, knowing what causes it, the next thing we want to look at is what are the symptoms. Pelvic inflammatory disease are in 2 stages. The first stage, it is usually asymptomatic. That means it doesn't produce any symptom. And that's why 4 people in every 10 women can have it and not know that they have it because it doesn't produce symptoms. Then when it now progresses, the disease has progressed further, then some symptoms begin to come out. And these symptoms, they usually mimic other infections. So you may not even know that you are having it. For instance, headache. Headache and several other things can cause headache, but headache is a sign of pelvic inflammatory disease. Particularly an headache that nothing seems to relieve. You take pain medication, it goes down a bit and then it comes up again. Also, you sleep and wake up after a stressful activity, it doesn't seem to be relieved. You need to that should give you some concern. Another thing is fever. You just have these sudden fever outbreaks. You just have fever today. Fever comes and goes. Sometimes it even mimics signs of pregnancy. You feel like vomiting. You may feel like, am I pregnant? You go to do pregnancy tests and it says, oh no, you're not pregnant. Especially for those people who are expecting. So it doesn't really have a concrete symptom, but some of these symptoms are the things that are associated with pelvic inflammatory diseases. So I talked about headache, there could be weakness, there could be cold, what you call chills, there could be fever, there could be waist pain. Yeah, waist pain is one thing that, it's most common. Now, this waist pain that is characterized with pelvic, that is associated with pelvic inflammatory disease, is usually worse with movement. You find that as you are resting in a position, you're not having the pain, but when you move around, you have those pain, then you need to check. Also, when you cough, if you feel pain in your lower abdominal region, your pelvic region is generally anywhere from under your belly button down, that's your pelvic cavity. So if you do a deep cough, you can try that right now. Just do if you feel a sharp pain or a pain, some form of discomfort, then you may want to check yourself. Also, there could be vaginal discharge, although this is not really, doesn't come with everybody, but there could be vaginal discharge, especially at the initial stage where the infection, when someone just contracted the infection. But after a while, there may not even be any vaginal discharge. They may be itching, they may not be itching. So you experience some of this discomfort, and like I said, several people don't have any symptoms at all. One of the main things that having pelvic inflammatory disease does over time is that it is one of the primary cause of infertility. I tell you. Secondly, it can cause ectopic pregnancy, and then it can be a sort of chronic waist pain. Chronic waist pain. I mean, serious waist pain that makes someone unable to even do basic work. So how do you diagnose if you maybe you are experiencing some of these things, or you just want to check yourself? How do you do? There are 3 tests that you can do that will help to know. First of all is an abdominal pelvic scan. Pelvic inflammatory disease, it could even spread to the abdominal region. It could even affect the liver. Yes, if the bacteria is not contained, it could just spread and cause systemic infections. So I always recommend people to do abdominal pelvic scan. That means they will do a scan to check both their abdomen and their pelvic region to be sure that everything is intact. And also you could do ESR. ESR is a very important test. It's a test to check the inflammation in the body. If there is an inflammation in your body, your ESR most likely will be high. Another test that you can do is an HVS, high vaginal swab. High vaginal swab will help to isolate what exact bacteria is causing the infection. If it is chlamydia, the approach is different from if it is gonococcus. So we don't use one rule, does not fit everybody. So you have to do these 3 tests. And then when you have done these 3 tests, what next? So I'm going to give you the home remedy shortly. If you're watching for the first time, please click on the subscribe button. Now, I told you that I have 2 remedies for you to tackle pelvic inflammatory disease. The 2 remedies, first remedy is the garlic remedy, and the second remedy is the onion remedy. I'm going to be talking first about the garlic remedy first. You do that for the first 2 weeks. First 2 weeks, you start with the garlic. First 2 weeks. Now, how do you do the garlic? Get a garlic bulb, a fresh garlic bulb, not a dry one, fresh one. You take one, get medium size, don't get too small so it doesn't get lost. Get medium sized garlics or big garlics, depending on the one you can find. And then you take one clove, just one piece of it. You peel it neatly, finely, and then get a clean needle. Just puncture the garlic a little bit, just little. Why are you doing that? You are allowing for the medicinal properties in the garlic to be able to fuse out through a process called diffusion. So you squat last thing at night. After you've done this, you have your shower, you empty your bowel, and then right there in the bedroom, you squat very low, and then you take this garlic and you insert it into your vagina using your index finger. You go in deep. You do that deep. As soon as the garlic is inside, you stand up. Once you stand up, you feel a taste of garlic along your throat. That's how you know that the garlic is still in situ. That means in situ means inside of you. Now you do this every night for 14 days. Only at night, please. In the morning, once you are ready to have your bath, just squat again and put your finger inside. Wash your hands properly, put your finger inside and remove the garlic. But most times when you wake up to pee, you find that the garlic will drop on its own. So you don't need to worry. And please do not douche during this procedure. Do not douche. Just remove the garlic and rinse off normally. So you do this for 14 days. I'd like you to try this for the next 14 days and send me a personal chat or a personal message or an email for me to know how it is with you. Now let's proceed to the second therapy. Now after you have done this for the next 2 weeks, you now proceed to the next 2 weeks, because it's supposed to be a 1 month therapy. So the next 2 weeks now you do your onion therapy. Now, onion therapy, please, you have to make your onion therapy every day. You don't do it and store it. Every day you do it, fresh one per day. Now, at night also, after you've had your meal, you take a very small size onions. I usually use the size of my fist, an onion that would be around this side of my folded wrist, just a small size like this. And then you peel the onions, remove the outer layer of the onions, and then you can use any color of onion, but I usually recommend the red onions, not the white onion. So you chop it into smaller bits. What are the instruments what are the items you require? First of all, you require your onions. Second, you require a mortar. Thirdly, you require a teacup. Fourthly, you require boiled hot water. Now, you peel your your onion, you chop it and put in your mortar, and then you pound. Why do you need to pound? Why don't you need to juice? We just want the medicinal properties of the onion to come out. We don't want your body to take it like food. Remember in my first video, I told you that there are different modes of administration of different things. And mode of administration may just be what would make something not effective. Not that it's not effective, but mode of administration. So please do not juice. Just pound it. Pound it until it is a bit semi-smooth. Of course, it will cause some tearing. That's fine. And then you add 2 teacups of boiling hot water. You pour it into the mortar, and then you cover it for like 7 minutes until it simmers. When I mean simmer, I mean until it steeps one, and then until it's a bit lukewarm. From boiling hot, it becomes lukewarm, and then it will be able to infuse. What are we doing? We are infusing. After that, you get a sieve. You require a sieve. So you get a fine sieve and you sieve out this solution, and then you drink it. You drink all of it. Yes, you drink all of it. You drink this last thing at night or first thing in the morning, but not both of them. It's either you do it last thing at night or you do it first thing in the morning. It's important you don't do it more than once a day, and then you don't do them together. And then I want you to take track of the symptoms that you were experiencing before you started this therapy. And then by the time you do this therapy, I like to hear from you, get your feedback, you can give your comments, and then if you have any other questions, you can ask. Thank you. I hope you have learned 2 remedies, 2 home remedies that are very effective. All of these 2 remedies have been proven with science, with research, and they are effective for PID. Ensure you do your tests. I'll see you in the next video. Have a great day.